This issue of trying not to stigmatize, it is very much on our mind as health reporters and also on our mind here in Washington, D.C. There was recently an attack not too far from where I'm sitting on several gay men who were accused of carrying monkeypox. They were badly beaten. How do you balance warning gay men that they're at elevated risk of this disease against the fear of inciting hate or even violence?
It's certainly been a tightrope that all public health agencies and all reporters such as yourself have been walking since the beginning of this outbreak. What's critically important is engaging with the communities themselves. So at WHO, we do that at global level. We have regular touchdowns with representatives of LGBTQ associations, various groups of people who advise us about the language to use, about the things to talk about, but also those are the same groups that should be contacted at every level, at every level of the response: national, federal, local, community. And so they will tell you, they will tell us, they do tell us, what are the channels of communication that are helpful? What are the messages that are helpful? What are the messages that may actually push people away, which is the last thing we want to do? So, for example, right from the beginning, WHO was working through messaging platforms that were not necessarily on the public website to begin with. We're putting more and more information on the public website now, but at the beginning, we were working through meeting apps, Grindr and others. We were working through associations, organizers of Pride festivals. Again, it's not the Pride Festival itself, which is a celebration of identity, but the events that may happen on the outskirts of a festival. So even today, we're becoming a bit more comfortable talking about situations such as saunas, bathhouses, places where there's sex on premises as part of the activities, because this is where the risk is. As I said before, it's not being gay that represents a risk. It's the activities where one might encounter others who may not even know that they're infected and that they may pose a risk to several people at the same time. And that explains why this can behave in the way that it does and in an amplifying manner where you have many cases occurring at the same time from a single large event.
Maybe one more question on the messaging and thinking about reaching the gay community. 40 years ago, HIV was originally seen as a gay man's disease. That's arguably why we missed, or at least a big reason why we missed, opportunities to try and stop that disease in its tracks. Now, it's 2022, different virus, different time. But Dr. Lewis, are there vestiges of that legacy with HIV that we are doomed to repeat in some way with monkeypox?
People are concerned about that legacy and the concern that mistakes may be made or mistakes are being made. But there are, of course, lessons to be learned and advantages. So for 40 years, people have worked on HIV prevention and control. For 40 years, people have worked on access to antiretroviral therapy. For 40 years, people have worked on community organization, community engagement, risk communication, and working with groups of people, including now, especially young people who don't have that memory of that era 40 years ago. So that is the positive. We build on that and learn the lessons from the stigmatization of people at that time, because at that time, what happened is a lot of it was driven underground, that people were, feeling stigmatized and would not necessarily seek out information. I think today what we're really trying to do is provide the information where it needs to be, which is for those who are at risk. This also includes members, family members, household members. So it's not exclusively men who have sex with men or people who have multiple partners. There can be others who have risk. For example, sex workers or family members of people who are just living in the same household or living in close proximity. And these are situations where people also need to be aware that others may be at risk. It's not the majority of the situation right now, and it's not something we want everybody to be very worried about. But it's important to, again, appreciate your own risk so that you can lower your own risk.